So thank you very much for joining us. A quick agenda for what we're going to do. I will spend a couple minutes at the beginning just to explain to you what the forum is, what our Queen Elizabeth Scholarship Program is, and then I'll introduce you to each of our 4 presenters, all of whom traveled abroad in the fall and had wonderful experiences, which you'll hear about today. We will then do questions for everyone, so we'll do the question period at the end of all 4 of their presentations. And then once that's finished, I'm going to tell you a little bit about our new Queen Elizabeth Scholarship Program, and then we'll move into the other room and have some refreshments, and you'll have a chance to ask our scholars questions about their experiences further. So come on in, have a seat, and we'll get started. So the McMaster Health Forum is the leading hub for improving health outcomes through collective problem solving. We aim to harness information, convene stakeholders, and prepare action-oriented leaders, and work as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the forum, our Queen Elizabeth Scholarship Program is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health systems leaders. We have had 3 cohorts of scholars so far. Here is the list of our first group of scholars who went abroad or visited us primarily in the calendar year of 2016. We saw an influx of applications after that first group, and so here's our second group of cohort, our second cohort, which was in 2017. Our 4 presenters today come from this cohort. And our last cohort in this particular Queen Elizabeth Scholarship Program is cohort number 3. We have a number of incoming scholars who will be visiting us in the summer, and then mainly undergraduates who will be traveling in the summer and or the fall this year to conclude this version of the Queen Elizabeth Scholarship Program here at the McMaster Health Forum. So we'll move right on to our next presenter, who is Jessica, also went to Australia, so also an undergraduate student in the Bachelor of Health Sciences program, specializing in global health. She's interested in health system strengthening, especially in rural communities and amongst marginalized populations. Jessica interned with the Australian Prevention Partnership Centre in Melbourne, where she aimed to learn how health systems research can be used to strengthen and improve upon existing frameworks. So, come this side. I'm going to stay right there.
So as James said, my name is Jessica, and I was in Melbourne for my QES experience, but I was actually working with the same people, or kind of some of the same people that Abir was working with as well, namely the Australian Prevention Partnership Centre. However, I was not in Sydney, obviously. I was based at Deakin University, which is a university in Melbourne. So just in terms of what I want to talk about today, I just want to briefly explain what CAPS, or the Australian Prevention Partnership Centre, is doing, the types of things that they're involved in, and then my project in particular, which was the Prevention Tracker project, and then moving into the stuff that I was doing as part of the team there, and then again close off with some personal experiences and insights that I had. So the Australian Prevention Partnership Centre is hosted by the Sachs Institute, as Abira mentioned, and its real purpose is to address the epidemic of lifestyle-related chronic disease in Australia at the national level. And it's a partnership with a variety of different stakeholders. So there's academics, there's policymakers, there's practitioners, and there's also a lot of different organizations that they work with, different universities and other institutes, that it's a very collaborative effort towards addressing this main concern. And the ultimate goal is to create a better system of prevention nationally throughout Australia. And so they're looking at various different components of the system and how they can make an impact in those areas. So Prevention Tracker, its tagline or description is describing, guiding, and monitoring system change efforts in local communities. So there's multiple stages of this project, and they really vary based on the community that we're working with, which I'll get into a little bit later. But if you can see from this diagram, A system is made up of a lot of different things. There's the organizations and networks in it, there's resources, there's the programs and policies that are being implemented, the actual people that are undertaking this type of work, the workforce, so the people that they recruit in order to carry out the plans that they have, the leadership structure, the governance structure in place, and the environment, so the actual physical space that is present and that you're working with. So all of these different things interact in different ways, and they really shape the system to be unique. So the first step of the Prevention Tracker project was to understand the local community's prevention systems. So this was done through a variety of different means. For example, we looked at livability indicators, so things like proximity to certain stores, proximities to gas stations, the population density in terms of access to like healthy foods and things like that. So all of those things were informing how the prevention system operated in a specific community. So that was the first step in terms of like describing the system that was in place. And then the next step was guiding and monitoring the prevention work in communities. So Prevention Tracker was focused on looking at what was there in the community and building upon it and enhancing it and finding ways to strengthen the capacities that already exist. So it wasn't so much about bringing in external resources as it was empowering the resources and capacities that are already there in place. So in terms of guiding and monitoring, we used a lot of different processes in terms of like community-based research methodologies and things like that to really help unpack the system with the stakeholders that we were working with in community, because no one really understands the system better than the people that are actually in it. And so that was the mentality that we adopted when we looked at guiding and monitoring the changes that were happening in the system and how the community themselves could work towards strengthening it. And then the last thing, or the last step, is using all of the knowledge that was gained from all of these very diverse communities to build a picture of what a national prevention system could look like and what the different components of that were in order for it to be very effective in terms of tackling chronic disease and preventing the high burden that is currently present. So Prevention Tracker actually started as a pilot project in Glenorchy, Tasmania. But when I went there in the fall, it was already expanded to Broken Hill in New South Wales, Albany in Western Australia, and the Gold Coast in Queensland. And so all of these different places are very, very diverse because they're not only located in completely different parts of Australia, but they also have very unique populations. For example, the Gold Coast is almost as big as Hamilton, actually, like about 500,000 people, whereas towns like Glenorchy are much, much smaller, and they're located on Tasmania, which is actually like an island off the coast of Australia. So as you can see, it was really interesting to just when you're describing the system, to just notice the different ways in which these prevention systems operated compared to one another, because they were so unique. I guess the ultimate purpose or the goal of this project is can be kind of encapsulated by the following. If we understand the parts of the system and how they interact, then we can make better decisions about where and how to intervene. So that was the ultimate goal of this project, is to really unpack the way the system operates and then present that back to the stakeholders in the community so they can better design their policies and their programs based on the environment or the system in which they're operating. So my role, I was an intern. So actually this is my team. So these were the lovely ladies that I was working with for 3 months. And they came from so many different backgrounds. And there's actually 2 Canadians there, yeah, which was really interesting to go into that team. And then 2 Aussies as well. And so then they came from a variety of different educational backgrounds, obviously different backgrounds in terms of like where they worked in the past, and then obviously where they're from. So it's a really nice team to work with, and I learned so much. And as an intern, of course, like one of the things that I was really doing was learning and asking questions and observing. And it was really interesting to see the ways in which each of these different women carried out their role based on the background and the expertise that they had. And they were so knowledgeable about the field. I could ask anything and they would have an answer that would inform it and create 10 more questions for me to look into actually. So yeah, it was a really great experience working with this team in particular, especially out of Melbourne as well at Beacon, because it was a university setting. So it was nice to see it's nice to see that research environment because this is actually one of the first research type of opportunities that I've taken up. And then in addition to just observing and learning from the team itself, I was also tasked with creating a literature review on systemic action learning, which I'll explain later on. And then in addition to that, I also assisted with some data collection processes. So I was able to actually go into communities with some of my teammates when they were carrying out the guiding and monitoring steps, so implementing a lot of those data collection processes. So I was able to go and observe and even help with some of those processes and methods that we were using in the communities themselves. So before I go into my literature review, I just want to explain what that term means, systemic action learning, or SAL. So action learning is actually a pretty straightforward concept, and I'm sure we've used it in a lot of the different work that we do as a student. It's basically when a small group of usually diverse people come together and you work on a real-world problem. And it's a cycle, so as you can see, I tried to recreate that here, where you identify a problem or you have an issue, and then you kind of question the assumptions that you currently have about that. So you challenge the views that you currently hold. You look into the different perspectives that each individual has in that group. You look into your biases and what type of influences are currently shaping the way in which you view this problem, because the ultimate reality is if the problem is existing, there can always be better ways in which you can address it. And so that's why you really have to have this questioning step in place when you're doing systemic action learning. And then you consolidate that learning. All of these different things that you surface when you're questioning what you already knew, you consolidate that to inform the practice. So for example, if you're implementing a policy and you realize that there's a misconception that you had, or you assumed a certain stakeholder wasn't going to play a certain role, but now you know otherwise, you consolidate that learning and then you adapt your policy to match what you've uncovered. Then of course you actually implement the policy or you do your action, and then you analyze that, successes, failures, what worked, what didn't, and then you continue on with that cycle of identifying new insights, and you keep repeating that. But what's important to note about systemic action learning is that first word, systems. And as I mentioned before, systems are made up of a variety of different things. And when you're doing day-to-day prevention efforts, you're mainly focusing on certain programs or policies that you're working towards. But there's a variety of other different factors that come into play when you're implementing a policy. So what we did is in systemic action learning is you actually infuse systems thinking into every step of this cycle that you see here. So when you're questioning insights, it's not just based on an insight about your specific program, but it's more looking at what are the resources that we can monopolize, I guess, or utilize to strengthen this, or who else can we bring in to provide some expertise or some knowledge in this particular area. So it's not just looking at the specific program, but looking at the broader scope of things in the entire system and how you can utilize its different aspects to strengthen the work that you're doing. So that's just briefly what system action learning is about. And how does that fit in with Prevention Tracker? So as I mentioned before, we have that guiding and monitoring stage in Prevention Tracker. And this is really where we go into the communities and we work with them on how they can use system action learning and system level insights to inform their practices. So it's like a cycle here. So day-to-day prevention efforts, that's the regular, the healthy eating program that someone's implementing in a community. But we use SAL to get together a diverse group of people to talk about the problems that they've been experiencing and then surfacing those system level insights. So in terms of is there a lack of formal partnerships? Why aren't we able to implement this policy to the degree that we originally thought? So these are the types of questions that you would be asking in an SAL process or an SAL meeting. And then once you have those system level insights, you would use a similar process again to allow it to inform your particular program. So if you realize that there's a lack of formal partnerships, you can then move into your action phase where you go and you create MOUs, or you have further partnership development sessions or things like that to strengthen your original program, because then all of these different changes that you make can help your program be more effective in the long run. So my literature review tackled 4 main questions. And so my lit review is obviously more theoretical as opposed to terms of the practice of Prevention Tracker. The first question was what fields of research we're using SAL methods. And then the next was why are we using SAL? Like why not just regular action learning? What's so special about systems thinking or systems approaches? The next is how exactly they're going about infusing that systems thinking into their action learning methods. And lastly, how those were evaluated. So I'm just going to skip over the first. Safe to say there was a diverse group of fields that were using SAL. But so why systems thinking? Was interesting to note that a lot of the reasons why systems thinking was incorporated into action learning was due to the diversity and the uniqueness of every problem that people were encountering. Because it wasn't just a very straightforward or linear problem. There were so many different components or factors playing into it. Like as I mentioned before, resources or finances and governance or politics and all these different things that were influencing that particular program. So they needed a way in which those factors would be addressed when you're engaging with problem solving. So that's, I guess, the overarching reason why systems thinking was implemented into action learning methods. And it's important, I guess, to understand that action learning is useful when you're dealing with any problem, but when you add that systems thinking component into it, it allows for deeper knowledge to surface. So you're not just looking at superficial data, or you're not looking at surface level insights, but you're really getting deep into the system, which may have been in place for like decades or centuries for other types of systems. So that's really more about why people are introducing systems thinking into their work. And the next thing I looked at was how were systems insights generated through the process. And as I mentioned before, it was very cyclical. So the hardest thing, at least what was found in Prevention Tracker, is how do you take like a very straightforward healthy eating program, for example, and how do you generate insights about governance structures in the prevention system? Like it's such a big gap to move into, right? So that was in particular the question that I was looking into, is like how are people ensuring that we're taking these very straightforward type of programs and generating these very higher level systems insights. And one of the interesting things that I found, I can't go into like the full detail, but was that they tried to look at how decisions came about. So when you're deciding on a particular aspect of your program, how did you make that decision? Like what evidence did you look at? Who did you consult? And then by challenging those assumptions, you could potentially see why there's a deficit in the way that the program is functioning. For example, perhaps you were so limited in the scope of evidence that you were looking at or the people you were consulting. Perhaps you needed to expand that. So even understanding the way in which decisions are made, that's one of the tools that's used to surface system level insights. And the last thing is evaluation. So evaluating SAL is very difficult because it's so contextually based. As I mentioned before, each system is very unique. There's different factors influencing every single prevention system that we looked at through Prevention Tracker. So it's hard to come up with a standard evaluation method, and other studies definitely showcase a similar experience. And it's also very subjective and hard to pinpoint if one thing caused another. For example, if you make a change in one aspect of the system, like a resource change, and you see a change in, I don't know, like health outcomes, for example, like how can you directly correlate one to the other? Like it's a harder thing to do. So a lot of the methods, though, we're looking in terms of like surveys, workshops, and interviews, because I really like this quote actually. So it says, the voices from our community partners and from our students showed us that there are values that simply cannot be measured. which is why a lot of the evaluation was focused on gaining people's perspectives on the project or the program or whatever it happened to be. And by understanding how people felt about it, that was seen as like a valuable piece of information that could guide the way in which you're changing your programs in the future. So that was a big way in which SAL interventions were evaluated in terms of people's feedback and people's perceptions of the success or the failure of the intervention. And other things were also like baseline measurements. For example, if you're measuring the amount of formal partnerships and you do an SAL intervention and you surface that more formal partnerships need to be created, you can go back like in a year later and look at how many more partnerships have been created. So that was another way in which you could kind of evaluate an SAL program. So one of the most impactful parts of the entire experience was actually community visits. So I was doing that whole literature review throughout the entire 3 months, but I was very, very fortunate to actually go with the team and into the communities, well, some of the communities that we were working with. So the first one that I went to was Broken Hill, and that's in New South Wales, and it's kind of like getting closer to that outback area. So you can imagine the landscape, the desert landscape, and it was very, very beautiful and very breathtaking to just be in that environment. And it was a mining town, so there's a rich mining history. There were museums and there were different things like that, and you can kind of sense it in the culture itself. It was super tight-knit, and I really enjoyed going to Broken Hill and just seeing that unique culture that was there in that town. And I was also able to go with some of my teammates as well, and we kind of explored the area in our free time as well, and that was really, really an amazing experience, I find. And another place that I was also able to go to was Albany, which is in Western Australia. And similar to Canada, actually, it's quite a distance to travel from one end of Australia to the other. And it's very, very different, even the landscapes and the culture and everything. And Albany was a coastal town, so right up against the ocean. And again, it was a very tight-knit community, and there was a strong sense of identity, especially in that community, and people had a clear view of what it meant to be someone from Albany, and that was really interesting to see, especially surfacing in their discussions and how that was informing their prevention system and the way in which it was designed. So overall, I would say I learned so much from the community visits because I was able to see what the work actually looked like in practice. So I was looking at system action learning, but when I went to the community, I could actually see the process being carried out in person, and it really helped me understand a lot of those theoretical or higher level concepts that I was looking into. Like, it helped a lot to see it actually go out in practice. And then other, I don't have a slide for this, but other insights that I was able to kind of gather was the importance of involving the community stakeholders in your research work, especially when you're looking at strengthening communities in terms of what capacities are already present. And one of the steps, one of the most important things that Prevention Tracker tried to do was gather a diverse group of stakeholders in each community and work with them continually throughout the project and updating them at every step so they were aware of what we were doing and why we were doing it. So it wasn't like we were going into a community to do work, but we were working with the community to strengthen what was already present. And again, as I mentioned before, it wasn't bringing external ideas and external, resources, or you should do this or you should do that. It was about the community taking ownership of their own system and using and empowering themselves and understanding their own system better in order to make the changes that they wanted to see in their communities. So that was, that was the biggest insight I would say that I really got from working on this project. And the last thing is that, as Abir mentioned, it wasn't all work. As I mentioned before, I was very fortunate to get to travel to different parts of Australia. These are all photos that I took, and I'm very proud because I'm not usually a good photographer, but these came out really well. And yeah, I was able to go to like Brisbane and Sydney and Perth and obviously like go into like an outback town at Broken Hill and then go to New Zealand afterwards as well. So it was just an amazing experience that I owe a lot to the QES program for giving me such an opportunity because I don't know if I would ever have been able to see all of Australia and really experience the culture without having this internship and having this placement. So yeah, thank you all for listening.
And we'll open it up now to the room for anybody who has a question.
So this is a suggestion from my father. He said because I didn't really understand the country as well. He said, okay, so book a place for like a week or 2 weeks because then you have some place to stay. And then before you make the 3-month commitment, for example, go ask around, learn about the areas, and then based on that, you should make your commitment. And I think that was a good idea because I actually changed houses 3 times within the first week. And I'm really glad I did that because the third house I found I stayed for 2.5 months, and it was probably the best choice. So I would also recommend that too. Very good question, Puru. So in terms of just adjusting to that, I think first off, I'd like to highlight that everyone is very, very friendly, and they do have a really human side of them. So it was really easy to connect when they were cracking jokes about having cookies or just eating a lot, etc. Like it was a very common joke because in Cape Town they eat a lot. So first, just recognizing that you're a student and the fact that they also recognize that you don't know everything. Aside from that, because there's so many interprofessional meetings, people had different background knowledge, so as a result of that, they did treat me as someone who had a specific objective, so they knew that I was here to discuss my research process, discuss the obstacles I face as well as my point of view, and work alongside them. So viewing myself as a team member, someone with different skills was one way to accommodate, and also just knowing that because as others have mentioned, we are there to learn as well, but also contribute, asking a lot of questions, and sharing that we're really engaged in the process as well. The fact that I did all the time to do my research just shows that I was involved, and it helped me become more comfortable. So it was just like, it's something that you will only know once you actually like dive in, for example, yeah.
Yeah, for sure. I think the one that comes to mind immediately was in Broken Hill. So I guess one of the reasons actually that Broken Hill was chosen as a community was that it does have one of the highest Aboriginal Australian populations there. And so it was definitely, like I was able to see this disparity between the types of services or even like the way in which the town looked compared it to perhaps like Albany, which was a coastal town. They had a history of like whaling, things like that, so they had a little bit, I guess the financial situation was a little bit different as well. And so I could definitely see that contrast. And then even in my own like personal travels, obviously up to like Sydney and like the Gold Coast as well, which is another community that we were working with. Like I could see the ways in which being more rural or more remote, kind of like in Canada as well, it can lead to certain like inequities in terms of the resources or funding that you can access. And I was especially interested, I guess, in looking into that difference between the Aboriginal Australian population and the larger Australian population. And so that was kind of prevalent, especially when I went into the more rural or remote communities. So,
I think for me, my biggest asset was kind of actually my ignorance because I didn't come in with any preconceived notions about what things should look like or how things should be. So much of my work before kind of making recommendations, which is part of the work that I did, but so much of it was just characterizing the landscape, and I did that with a fresh set of eyes, and I think that a lot of people who were kind of looking at my work were noticing that I was picking up on things they had already that they had always glossed over because they were just so familiar with it. I was able to look at it in a more critical lens, and I think that was valuable because of the work that I was doing specifically.
Yeah, I would say for me, literally like my time, I guess, like my effort, because the way this project was so fast-paced. When I went there, I was thrown into the middle of this data collection meeting, and I was so lost, and like we were moving so fast through all the different communities, like, and this was a component of work, this literature review that they needed to have done, but there wasn't really anyone to do it. So I think that was like an asset I brought, is that, I guess, that ability to contribute to the team and like do something meaningful, as you were saying. Like this was a piece of work that they needed and they wanted, they just didn't have the time to do it. So I guess that would be something that I brought.
Yes, in order to Mina, I would say just this ability to ask questions, coming in from, again, like a fresh pair of eyes. And for me, what they found really interesting was that they had no idea that I worked on like a health tech startup, and I'd sort of brought in my understanding of
like software, and I was like, hey, what you're studying is actually a lot like this thing in business, and they were like, we did not know that. So it was just this idea that you're coming in with your own unique background, and you can point things out and ask questions that they wouldn't necessarily have thought of otherwise. So it's just another diverse person to the mix. When I describe, like I've tried to describe like what I brought in from other things, and I think it's really not about necessarily content knowledge, but about really just this ability that you come in with to be able to find that information. So the skills you've built up over the last couple of years of undergrad in finding information and taking initiative and sort of confronting those challenges and asking for help are probably going to take you much further than a particular course in the program will.
Yeah, I just want to really kind of reiterate and reinforce that the inquiry process and learning how to ask questions, that shouldn't be understated. You would be surprised at how many people don't know how to ask good questions and don't know how to answer, like find answers to them. And it's not about knowing things, but about being able to get to answers and having kind of those strong research skills. And I don't mean like wet lab research or anything like that, but I mean kind of critical thinking, critical analysis, being able to analyze a piece of literature and understand what it's really saying versus what it thinks it's saying, and that kind of stuff. And all of that, I mean, critical crap, for instance, health pol, all of those courses kind of teach us those things. So I think, was it Jessica actually kind of, was it you? Sims, actually, this idea of co-design. So I think in the work that I'm doing, kind of like in health with innovation, both in Toronto and then that I kind of did in Leeds as well, co-design is this idea that the people that are going to build the solutions and the people that are actually going to use them and be the people who are kind of maybe part of the problem, not like the problem, but as in maybe they have that health issue or whatever, they're all together in kind of the ideation phases to talk to each other, to communicate, to understand like what do we want this to look like realistically when they're left out of that decision-making kind of process in the early stages. That's where some of the implementation issues come in, because when it comes time to implement this, because the clinicians were not there and it was just maybe a bunch of researchers and some I don't know, engineers, they can't foresee certain things, right? And having those perspectives are really important in being able to catch them early on, implement them into the design of whatever it is you're working on, whether it's a policy or a piece of technology, and then that addresses kind of some of the issues that come later down the road.
I guess having a policy window or or political and social environment that is conducive to results, it really helps push the process forward. And just to re-highlight, engaging multiple perspectives, having certain deadlines, and something to really push forward the implementation, I think really helps. So for in my case, we were so limited on funding and because there's no specific committee, it was really hard to implement and push things forward. I think that's where like the policy window or having some sort of impetus would be really useful as well.
I mean, I think with me, so like in terms of scale, like we don't have like a Canadian health system, right? We have the Ontario health system, and the Ontario health system is so much smaller than the NHS. It's just in terms of the number of people working in it, but also the resources and funding available. But I think coming back from the NHS and seeing how, I mean, there's always this joke that the NHS is behind because they're just kind of like this big lumbering organization and they think they're not innovative. I thought they were actually really innovative, and I came back and I kind of took that back to my team in Toronto, and I was like, oh, they're implementing like these types of programs. They have this kind of government support that just doesn't exist here, and everyone was a little shocked. Like they didn't realize that that was the case, and I think that we do have a lot to learn from them in terms of the way that they go about funding and supporting health innovators, which I know is like a very specific thing that not everyone's interested in, but that was something that I took away, realizing that they were a lot further ahead than we were, but just because we're kind of newer and shinier, people think that's not the case.
So I'm cognizant of the time, so I'm going to draw it to a close, and I want to thank all of our scholars again for their presentation. So give them your appreciation. to today's session. That first link that's on the screen right now is the link to our scholarship page. So when we do update it and we announce the application window, that's where you can find it. We will continue to have webinars. So we are at the end of the webinars for the second cohort, but of course our third cohort, all of those students will be conducting webinars in the future when they come back. So look for a series of webinars in the fall. And they also all write blog posts. So all of them write a blog that is posted on that third link. The MacHealthForumScholars.com website has blogs from all of our scholars back to the first cohort. Gives you an idea of the more personal side of things. And all of the scholars that you saw today will have a blog post there as we go along. So thank you for coming.